Hello, my name is Quincy George and I'm a registered nurse. I understand your provider has prescribed you a new medication to be discharged home on. My goal is to teach you and your family what that medication is for, how to properly administer the medication, possible side effects, and things to avoid while taking this medication. Let's get started. Your provider has prescribed you a Lovenox injection. This medication is used to prevent clots from forming in the blood. Medications such as Lovenox are also known as anticoagulants or blood thinners. Blood clots left untreated can travel to the lungs and form pulmonary embolisms. Blood clots to the lung can be fatal. Usually another anticoagulant such as Coumadin is started 2 to 3 days after Lovenox has begun. The Lovenox is continued until the other anticoagulant begins to work. Your provider will be able to judge the length of time you will be on the Lovenox by measuring the length of time it takes your blood to clot. Let's move on to how to properly administer the medication. Let's first start by talking about selecting the injection site. The injection will be given in the belly of the abdomen or around the waist. This will be given subcutaneously, which means it will be given in the fat surrounding the abdomen. You want to make sure you're rotating your injection sites. For example, we will be giving your injection today on the right side, and the next time that you give your injection, you can rotate to the left side. You also want to be at least 1 inch away from any scar and at least 2 inches away from your belly button. You also want to avoid any swollen or tender areas. The first thing you want to do is you want to make sure you gather all of your supplies. Next, you're going to wash your hands with soap and water or an alcohol-based hand sanitizer. You're then going to want to find a comfortable position, either sitting or lying, but making sure you're able to see your abdomen. Next, we're going to be checking our medication. You want to pick up the syringe and make sure it's the correct medication, and make sure you check the color. Make sure it is a clear color or a pale yellow. It should not be discolored. If it is discolored, do not give yourself the injection, but call your provider. Let's talk about the air bubble. In the syringe, there will be an air bubble. Do not expel this air bubble. Unless your provider has prescribed you a specific dose of medication, the air bubble ensures that all the medication will be administered. Let's choose our site. We have talked about choosing the right side today, and as a reminder, after this injection site, we want to rotate to the next injection for the next time we give the medication. We're then going to cleanse the area with an alcohol pad or alcohol. You're going to want to make sure that you let this dry completely before you administer the medication. Next, we're going to pick up our syringe and we're going to remove the needle cap by pulling it straight away from us. We're going to hold it in our dominant hand like a pencil. We can then dispose of the needle cap into the sharps container. Next, with your other hand, you're going to want to pinch the skin with your forefinger and your thumb, creating a skin fold. You're going to hold this the entire time you give the injection. We're going to insert the needle at a 90-degree angle, and then you're going to want to press down on the plunger to administer the medication. Once all the medication is administered, you're going to remove that syringe and needle the same way that you administered it at a 90-degree angle. You're then able to let your other fingers go and release the skin fold. As a reminder, you do not want to rub the area as this can increase bruising. Next, you're going to want to keep the needle away from you. Some syringes come with a needle shield guard. If yours comes with this, you're just going to want to press down hard on the plunger and you're going to hear a click. And once you hear that click, then you're able to dispose of your syringe and needle in the sharps container. You also want to avoid stinging yourself or anybody else. Then you want to wash your hands completely, and as a reminder, you can document on a calendar the date, time, and the injection site, just so you know what injection site you did last. Let's move on to possible side effects. Possible side effects that you want to report to your physician could include any allergic reactions such as skin rash, any hives, any swelling of the face, lips, or tongue, any feeling of faint, lightheadedness, or falls, any signs and symptoms of bleeding such as bloody black tarry stools, any spitting up blood or brown material that looks like coffee grounds, any red spots on the skin, or any unusual bruising or bleeding coming from the eyes, gums, or nose. Things to avoid while taking this medication. You want to avoid things so you don't cut yourself, any sharp objects, any increase in alcohol or variable alcohol usage. This can increase your risk of bleeding. You want to limit your physical activities or any sports that could cause injury or any falls. You also want to let your physician and your dentist know that you're taking this medication, especially if you plan on having any procedures done. We have now reviewed what medication you're going to be on, how to properly administer this medication, possible side effects, and things to avoid while taking this medication. Do you have any questions for me?